Now, using our 3 steps, let's break this down. This question is asking for incorrect patient statements regarding the key problem, patient on metronidazole. So before looking at the options, we're thinking metronidazole ends in dazzle, so it's an antibiotic for gut bugs. And there's no alcohol during and after really any antibiotics here. So just think dazzle is what the drug ends in, so it's a C. diff infection. Basically, it treats C. diff in the gut, so there's nothing dazzling about C. diff. So the memory trick we use is metro for metronidazole. M for metallic taste and dark urine, which is normal. There's no need to report this to the HCP. Now the E in metro is E for ETOH, to avoid, basically no alcohol. And then the T is it treats C. diff as well as trichomoniasis, that STD. And then R in metro is a rash or skin peeling to report. This may be Stevens-Johnson syndrome. And then O in metro is that, it's not dazzling to have C. diff. So remember, dazzles are treating C. diff. So the solution we're looking for are the incorrect patient statements. To make this question even harder than it already is, we're looking for additional teaching here. So option number 1 is correct here because it requires additional teaching. So brown or dark urine is to be expected. So remember, M for metallic taste and metallic urine, which is normal. And option 2 is also correct. We're talking no alcohol with this medication. Remember, the E in metro is E for ETOH, to be avoided. And option 3 is incorrect because it's not normal to have skin peeling. This may indicate a very life-threatening Stevens-Johnson syndrome. Remember, we're looking for the incorrect or wrong options here. And option number 4 we have to choose because expected that the medication can cause this metallic taste. And lastly, option number 5 we have to skip because, guys, no alcohol for at least 3 days after the med is done. Remember, 3 and you're free. That 72-hour window after the medication is complete for metronidazole. Okay, that wraps it up. Now, using our 3 steps, let's break this down. This question is asking for findings to report for the key problem. You're prepping the next dose of gentamicin. So before looking at the options, we're thinking gentamicin is an antibiotic, and it could be nephrotoxic. So the memory trick we use is we say it's a sin to give a mycin because we're looking for kidney toxicity. So remember, you have 2 kidney labs for 2 kidneys. So creatinine and BUN. So creatinine over 1.3 is bad kidney, and BUN is 20 max. And general kidney function here is urine output 30 mLs per hour or less, means the kidney's in distress. And then tinnitus, the ringing of the ears, could indicate kidney toxicity. So just think you have 2 ears, just like you have 2 kidneys. So if your ears are ringing, it's like a little alarm clock telling you the kidneys may be toxic. So the solution we're looking for is indications of complication of this antibiotic here. Now, option 1 is correct. A BUN that's elevated over 20 may indicate nephrotoxicity. And option 2, also correct. Creatinine elevated over 1.3 means bad kidney. May indicate that nephrotoxic, guys. And option 3, a ringing in the ears may indicate ototoxicity. Remember, if you have 2 ringing ears, it's like little alarm clocks or alerts that tell you you might have 2 toxic kidneys. And option number 4 is incorrect. That's a prolonged QT wave, not a cause of the medication. That's for a thromycin, not for just a mycin. I know it can be confusing, but we cover this in our full antibiotic lectures here. So just remember, thromycin throws the QT wave, making it prolonged. Now, option 5 is correct here. Urine output is only 20 mLs per hour. So remember, 30 mLs per hour or less means the kidneys are in distress. That key term or key number there is 30 mLs per hour. Okay, that wraps it up. Now, using our 3 steps, let's break this down. This question's asking for the priority action of which med to intervene. The key problem, a toddler with flu-like symptoms who just got a medication. So before looking at the options, we're just thinking any toddler. That's the key word here. We have to avoid aspirin, or aka salicylate, for possible Ray's syndrome. So the solution we're looking for are meds that could lead to the worst possible outcome. Now, toddlers with salicylate, they don't mix. So option number 1 is correct. Bismuth subsalicylate. The key word here is salicylate. This is technically this is technically aspirin in the aspirin class. So we have a big risk for Ray's syndrome. Now, the rest of the options are incorrect. So option 2 is incorrect because electrolyte fluids are recommended for fluid volume deficit, so it's okay to give. And option 3, also incorrect. Toddlers don't typically get naproxen unless ordered by the HCP. And option number 4, ibuprofen is okay to give. Okay, that wraps it up. For more details, now using our 3 steps, let's break this down. This question is asking for priority action of what to do now. The key problem, you're prepping ceftriaxone. The patient has an allergy to sulfalazine, as well as penicillin, and levofloxacin. Oh my gosh, you have all these medications, guys. So remember, cephs and cillins, guys, they don't mix. An allergy to one means an allergy to the other. So just remember, cillins and cephs, we can't mix. So ceftriaxone and penicillin, we can't give together here. So the key solution we're looking for is we need to assess this patient before giving the medication to prevent the worst possible outcome, which would be that allergic reaction here. So option number 1 is the best assessment. I know this question and the options can be very tricky here, but it's always best on the NCLEX to assess the patient first. So assessing what the allergy was, this patient, guys, always the patient first. So this patient might have a reaction to the medication, but we always assess what type of reaction it was. And it's always best to assess that patient. Now option 2, 3, and 4 are incorrect. So option 2, assessing the airway and breathing, does nothing for the medication right now, medication administration. And option 3, the HCP, not the pharmacy, can change the medication orders. And option 4, this one is really close. So double checking the allergy list is good, but it's better to assess the patient and not the documentation, and don't assess the machines before you assess the patient. So option 1 is our best option here. Okay, that wraps. Now using our 3 steps, let's break this down. This question is asking for incorrect actions for the key problem, patient on nystatin for oral candida. So before looking at the options, we're thinking it's an antifungal, we have to complete the course, and we swish and swallow the medication. So big caution, this sounds a lot like statin, which is a cholesterol drug. But guys, it's not statin, this is nystatin for that nasty fungal yeast infections inside the mouth. So we shake well, swish inside the mouth, and yes, you swallow. It's only with the steroids that you don't swallow. So with this medication, it's an antifungal, so we swallow. And the key tip here is you continue 48 hours after the sign and symptoms subside. So the solution we're looking for are incorrect actions by the student nurse. So option number 1 is incorrect here because dentures are treated as well and it goes in the mouth where the infection is. So remember, we're looking for the incorrect things or the wrong things here. So option 2 and 3 are correct here because you don't stop taking the medication, you continue 48 hours after the signs and symptoms are gone. And option 3, yes, we shake the oral suspension before you take it, guys. So shake it before you take it. So remember to mix the solution. And option 4, we have to skip because it's correct. It's appropriate to swish and gargle for a few minutes because we have that oral infection inside the mouth. We want to move that medication around. And option 5, we have to choose because it's one of our wrong things. So stopping the med will not cause herpes zoster, which basically is that herpes simplex 1, those cold sores. No indication and no risk for herpes zoster if you stop the medication too soon. Okay, that wraps it up. Now, using our 3 steps, let's break this down. This question is asking for incorrect statements for the key problem tedizolid for MRSA. Guys, this is a big, tricky question. So don't be too hard on yourself if you miss this. So this antibiotic with an MAOI is an antidepressant relation. So remember, MAOIs you can't mix with any other antidepressant. So we're looking for no antidepressants here. And MAOIs, you have to avoid tyramine, so no wines, cheeses, or meats. So the biggest solution we're looking for is the incorrect remark by the patient. So option number 1, fluoxetine is an SSRI. So technically, since the relation is so close with this drug, we can't take with an SSRI. So remember, this drug has a relation with an MAOI. So remember, MAOIs, you can't mix with any other antidepressant. We have risk for serotonin syndrome. Now, option 2, 3, and 4 are incorrect because it's okay to take with ibuprofen. And option 3, we avoid tyramines. They have the MAOI properties. And option 4 is incorrect because you can't take with an SSRI with that serotonin syndrome. So option 1 is our best option here. Okay, that wraps it up. Now, using our 3 steps, let's break this down. This question is asking for which patient is safe regarding the key problem, live intranasal flu vaccine. So, we're just automatically thinking a flu vaccine. We can't give it to anyone who's immunocompromised, and it has to be age appropriate, and vaccines are not really given to pregnant patients. So, the solution we're looking for is the patient who's eligible to receive this vaccine. So option number 1 is incorrect. A 16-month-old is too young for a vaccine. Now option 2 is the most correct here because a 19-year-old with a key term postpartum after pregnancy. And option 3 and 4 are incorrect. Again, pregnant patients cannot get vaccines. And option 4 was a little bit tricky. But Guillain-Barré syndrome is an autoimmune disease, and we have immunocompromised patient here. Okay, that wraps it up. For more details and now using our 3 steps, let's break this down. This question is asking for which scenario for the key problem do you hold Vanco and report the findings? So before looking at the options, we're thinking any sign and symptom of complication and levels that are high with Vanco. So let the name help you here. Vancomycin is very toxic to the kidneys with the peak at 20 maximum. So we say that it's a sin to give a mycin with vancomycin because it's very kidney toxic. So remember, we have 2 kidney labs for 2 kidneys. So creatinine and BUN. So creatinine over 1.3, we just think it's a bad kidney. And BUN is 20 max. And then in terms of kidney function, urine output 30 mLs or less means the kidneys are in distress. So really the solution we're looking for here in these options are any peak over 20 and any creatinine over 1.3. These 2 are the most important here. Now option number 1 is incorrect because the Vanco, the creat, and the BUN, guys, the levels are normal here. Now, option 2 is correct. Vanco trough is normal, but the creatinine is elevated, 1.4. Remember, over 1.3 is bad kidney, and the BUN is normal here. Now, option 3 is also correct. The vanco trough is normal, but again, the creatinine is elevated. Remember, over 1.3 is the bad kidney, and the BUN is normal, so we have possible renal impairment. And option number 4 is incorrect. The vanco, creat, and BUN are normal here. And lastly, option 5 is correct. The vanco, the creat, and the BUN is elevated. Guys, huge risk, or basically this option is indicating big time renal impairment. Okay, that wraps it up. Now, using our 3 steps, let's break this down. This question is asking for priority labs for the key problem. You're reviewing these lab values. So before looking at the options, we're just thinking anything that saves the patient's life. So ABCs, safety, as well as immunocompromised patient, as well as anything that has to do with loss of life or loss of limb. So really anyone who bleeds out or has immunocompromise. So the solution we're looking for are labs that may lead to the worst possible outcome. So option number 1 is incorrect. Increased WBCs with an infection is to be expected because the body's fighting off the infection. Now option 2 is correct. Low WBCs of 2,500, taking an anti-cancer drug that drops the immune system big time. Guys, we have a big high risk for immunosuppression and big infection here. Now option 3 is incorrect, but it was really close. So yes, technically INR, that blood coag study, is slightly elevated. The normal is below 1.1. Now, if the patient's on blood thinners, then the normal INR is 2 to 3.0, which is normal. But it's to be expected with this type of patient because they have hepatitis, so liver inflammation. And remember, the ABCs of the liver, C for clotting factors or coag factors. Now, option number 4 is incorrect as well. This is a zone-ending steroid, which increases the sugar, increasing blood sugar, which is to be expected. So just think zones are steroids, which increase the sugar. Okay, that wraps it up. For more details and test tips, please see our rationale below. Now, using our 3 steps, let's break this down. This question is asking for findings to investigate for the key problem, vancomycin every 12 hours. So before looking at the options, we're thinking, what do we know about vancomycin? Well, this antibiotic given to a patient with a bad infection. So we just say vanco is very toxic to the kidneys. Now, the peak and troughs, we're looking for the peak to be max at 20. And vanco is very hard on the vessels or the veins. So we give it very slow over an hour, and it could lead to red man syndrome. And lastly, we always say that it's a sin to give a mycin because it's very toxic to the liver, toxic to the kidneys here. And speaking of toxicity to the kidneys, 2 kidneys for 2 labs for the kidneys. So creatinine and BUN. We always say creatinine over 1.3 means bad kidney, and BUN 20 is the maximum. As well as urine output 30 mLs per hour or less means the kidneys are in distress. And then the very last thing is tinnitus, or this ototoxicity. Basically, ringing in the ears could indicate kidney toxicity. So just remember, you have 2 ears, just like you have 2 kidneys. So ringing in the ears is like a little alarm that tells your kidneys may be toxic. So the solution we're looking for are manifestations that may indicate a problem with this medication. So option number 1 is incorrect because the BUN is normal. Remember, the maximum is 20 here for BUN. Now option 2 is correct. So remember, creatinine is high over 1.3 means bad kidney, indicating nephrotoxicity. Now, option 3 is incorrect. The neutrophil count, whether it's high or whether it's low, we're looking for kidney toxicity here. And technically it should be high because the patient has an infection, right? That's why we're giving the antibiotic. Now, option number 4 is incorrect. Mental status changes should be assessed by the nurse, but in this case, it's not priority with vancomycin. And option 5, a trough of 15 is okay. Remember, 20 is the bad one here. So peaks and trough, we're looking for toxicity, and 20 would be maximum. And lastly, option number 6, this ringing in the ear may indicate ototoxicity, that tinnitus. Remember, 2 ears, we have 2 kidneys, so ringing in the ears indicates kidney toxicity. Okay, that wraps it up. Now, using our 3 steps, let's break this down. This question's asking for adverse effects to report immediately for the key problem, ethambutol, PO. So before looking at the options, we're thinking this is an anti-tuberculosis medication. So the memory trick we use is E for embutol, or ethambutol, E for eyes. So guys, any type of eye or vision difficulties with ethambutol, the eyes. So we're talking blurred vision, color changes, or anything that have to do with the eyes. And like any powerful antibiotic, it can be hard on the nephros, or basically the kidneys. So we're thinking nephrotoxicity. So the solution we're looking for are complications of this ethambutol. Option number 1 is incorrect. Anorexia is not a complication of ethambutol. But option number 2 is correct here. So difficulty seeing colors may indicate an optic neuritis, or basically the eyes of ethambutol. Now, option 3 was a really tricky one here. So, tea-colored urine may indicate a kidney issue associated with nephrotoxicity. But that was really tricky. So don't get too hard on yourself if you missed that one. Now, option 4 is incorrect here because yellow sclera is the key term that may indicate liver issues. But this medication is not hepatotoxic, more damaging to the eyes. So option 5 is correct. Vision changes may indicate optic neuritis. Just remember the eyes and ethambutol here. Okay, that wraps it up. For more details and test tips, please see our rash. Now, using our 3 steps, let's break this down. This question's asking for possible problems for the key problem, patient getting vancomycin and tobramycin. So let the name help you here. Just think 2 mycins are very toxic. So we say that it's a sin to give a mycin because it's very kidney toxic. So remember, you have 2 kidneys for 2 kidney labs here. So creatinine and BUN. So remember, creatinine over 1.3 means bad kidney. And BUN maxes out at 20. And urine output 30 mLs per hour or less means the kidneys are in distress. Now, a little side note, vancomycin, we just think that vanco, we have red man syndrome if it's given too fast. So we have to give it about an hour here. So the solution we're looking for is toxicity of the kidneys here. So option number 1, the BUN is normal, so it's incorrect. Now option number 2 is correct. The creatinine is high, so it may indicate renal impairment, nephrotoxicity. Remember, creatinine over 1.3 or 1.3 and more is bad kidney. And option 3, 4, and 5 are incorrect because bruising is not a complication, so usually that's with blood thinners. And option 4 and 5, low RBCs and petechiae, it's not a potential complication with these kind of meds. These are antibiotics. These are not blood thinners. Okay, that wraps it up. For more details and test tips, please. Now, using our 3 steps, let's break this down. This question's asking for which vitamin prescribed for the key problem taking isoniazid. So this question is super tricky, but listen close here. Isoniazid interferes with B6. So this is also called INH. Memory trick we use is just INH. So I is it interferes with B6, that pyridoxine. And N is for neuropathy, we report numbness. And then H is for hepatotoxicity, that liver toxic. But for this question, the solution we're looking for is vitamin to maintain B6 levels. So option number 1 is incorrect. Folate is technically B9. So can't choose it here. Now option number 2 is correct. This is B6. So pyridoxine. Guys, write that down if you don't know that. Pyridoxine is B6. And option 3 and 4 are incorrect here. So cobalamin is B12 and calciferol is vitamin B2 here. Talk about a mouthful. So option number 2 is the most correct. Okay, that wraps it up. For more details and test tips, please see our rationale below. Now, using our 3 steps, let's break this down. This question's asking for incorrect action regarding the key problem, colitis and IV vancomycin. So, before looking at the options, we're thinking colitis. So, itis means inflammation, and col, we're just thinking colon. So, inflamed colon. And we're giving you vanco with the V, which is very toxic, and it burns the vessels of vanco. And we give this very slow, since it burns the vessels, over 1 hour. So really the biggest thing here is giving it over 1 hour, very slowly. So the solution we're looking for is incorrect action by the student nurse. So option 1 is correct, option 1 is incorrect here because infusion pump is good. Remember, we're looking for the incorrect option, or basically the wrong things here. So option 2 we have to choose because it's the incorrect thing to do. So giving vanco over 15 to 30 minutes, guys, not 1 hour is the wrong thing. Since vanco burns the vessels, it can cause red man syndrome, so we slow it down. Always give vanco over that 1 hour mark. Now option 3 and 4 we have to skip because it's appropriate to assess for red man syndrome. And option 4, we do monitor for infiltration every 30 minutes, so that's appropriate. So option 2 was the wrong thing to do. That's why we have to choose it. Okay, that wraps it up. Now, using our 3 steps, let's break this down. This question's asking for the most significant teaching regarding the key problem, rifampin 300 milligrams PO, BID. So the key term there is rifampin, which is a tuberculosis antibiotic that stains the body fluids. So the memory trick we use is rifampin, just think red fampin, or reef fampin, like a red coral reef. It just turns the body fluids orange and red, which is completely normal. Now we teach patients to wear glasses, not contacts, since the fluid inside the eyes can stain the contacts. And it's not normal for jaundice, that's liver toxicity, so we monitor the patient for jaundice. And lastly, we use non-hormonal birth control here for these patients. So the solution we're looking for is the education for this patient. So option number 1 is correct. The medication can stain the body and stain contacts, so the key term is to avoid contacts. We wear glasses. So just think rifampin, you're going to go look at a red coral reef. So you need goggles, or basically glasses, and not contacts. And option 2, 3, and 4 are incorrect here. So no alcohol with this med because it's liver toxic. And option 3, discoloration of body fluids is to be expected and normal. And option 4 is also incorrect. We don't stop the medication. Guys, only 3 samples that come back negative means you're free or infectious free. So remember, 3 and you're free. 3 negative sputum cultures and you're free from TB. And lastly, option number 5 is correct. The decreased effectiveness of birth control pills with rifampin. So we can just say, like you're scuba diving with that red coral reef, so you better not be pregnant, or you better have a non-hormonal birth control pill. Okay, that wraps